Hello, I'm Dr. Gary Gruber, and welcome to a new office talk. Today, I will explain the similarities and differences between mammography and regulation thermography, also known as regulation thermometry. For more than 30 years, mammography and regulation thermography have been used as a screen for breast cancer. A mammography is a simple X-ray of the breast tissue. Regulation thermography is a recording of the change of skin temperature and is based on the science of temperature regulation. Regulation thermography is not an infrared picture. Mammograms are not without health risks. It is estimated that 70% of women between the ages of 40 and 70 have annual mammograms, the purpose of which is to screen for breast cancer. Women agree that the procedure is at best inconvenient and uncomfortable. Also, women are concerned about an annual dose of ionizing radiation, which in itself may cause cancer. There is also a hidden risk associated with mammography, the risk of improper diagnosis, particularly overdiagnosis. In a landmark 2012 study from the New England Journal of Medicine, Doctors Blyer and Welch looked at the question of breast cancer screening with mammography. According to the researchers, breast screening must detect the disease at an earlier, more treatable stage in order to prevent death from breast cancer. They stated, quote, effective cancer screening programs therefore both increase the incidence of cancer detected at an early stage and decrease the incidence of cancer presenting at a late stage. After studying and analyzing the results from 3 decades of data collected by the National Health Interview Study, the researchers concluded that despite substantial increases in the number of early-stage breast cancer detected, screening mammography has only marginally reduced the rate at which women present with advanced cancer. Although it is not certain which women have been affected, the imbalance suggests that there is a substantial overdiagnosis, accounting for nearly a third of all newly diagnosed breast cancers, and that screening is having, at best, only a small effect on the death rate from breast cancer. Therefore, mammography should be used to help women diagnose the quality of a tumor, but as a screening tool for prevention of cancer, it is ineffective. Dr. Eric Topol is a leading developer in innovative digital technologies with the highly regarded Scripps Research in La Jolla, California. In a recent article, Time to End Routine Mammography, Dr. Topol states, we have come to rely on a test that is notoriously inaccurate but has become a fixed part of American medical practice since it was introduced almost 50 years ago. With the tens of millions of low-risk women unnecessarily undergoing screening each year, any test would be vulnerable to a high rate of false positives. A mammogram is simply a yes or no question. Does the breast tissue have a lesion or potential tumor? On the other hand, regulation thermography answers the question, what is the health of the breast tissue? And is there an underlying condition that makes the breast tissue more susceptible to cancer? Therefore, regulation thermography may be a more effective screening tool for breast cancer and breast cancer prevention. Regulation thermography directly assesses the quality of breast tissue by measuring temperature regulation of the whole body. A blocked or dysfunctional temperature point indicates the need for additional diagnostic investigation and possibly intervention and treatment. For example, lymphatic circulation plays an important role in breast health. The fatty composition of breast tissue makes it vulnerable to fat-soluble toxins. The removal of these toxins is dependent on a highly functional lymphatic circulation. Regulation thermography assesses 14 bilateral points associated with lymphatic drainage of the breast tissue. When there is blocked lymphatic drainage, an alarm is raised for accumulating toxins. These accumulating toxins may be the initial cause of breast cancer in women with susceptibility. While there may not be a detectable tumor, early intervention with appropriate treatment would be advisable. Regulation thermography is an excellent diagnostic tool for breast cancer screening for the following reasons. A. Analyzes functional physiology. B. Detects dysfunction before disease. And C. Clarifies the cause of dysfunction and disease. It's important to note that regulation thermography does not replace the appropriate usage of mammograms. In fact, regulation thermography has the ability to identify patients at the highest risk and actually increase the effective usage of mammograms. Thank you for watching, and look for more educational videos about regulation thermography at the website www.drgruber.org.